Hello, my name is Brianna Shaw, and I'm the president of GVHS Medical Society. Please join me in extending a warm welcome to Dr. Puya Momtaz, a distinguished orthodontist who has made a significant impact in the field of orthodontics. Dr. Momtaz grew up in Boston, Massachusetts, inspired by his father, a medical doctor, to pursue a career in orthodontics. He received his undergraduate degree from Boston University and earned his DMD from Tufts School of Dental Medicine. After completing a general practice residency at St. Barnabas in Boston, he moved to Las Vegas where he completed an orthodontic fellowship, an orthodontic residency, and a master's degree at the University of Nevada, Las Vegas. Dr. Momtaz is the proud owner of Align Orthodontics, known for his patient-centered approach and excellence in smile transformations. As one of his patients, I'm thrilled to have him here for a fireside chat, especially since other dental professionals have praised his work, which is a rare and impressive compliment in this field. Dr. Momtaz, we are honored to have you share your insights in a fireside chat with the GVHS Medical Society today.
Thank you very much. Thanks for that intro.
Yeah, of course. Okay, so we're going to kick off with our first question.
Okay.
Hi, I'm Daisel. I'm the Secretary of Medical Society. As an orthodontist, you're in a specialized field of dentistry that directly impacts patient confidence and long-term dental health. What advice would you give to students who are interested in pursuing a career in orthodontics, and how can they prepare themselves for this specialty?
Okay, that's a great question. I mean, so I'm kind of not your traditional student. I took a longer road than probably most others. As Brianna mentioned, a lot of school with the fellowship and the residency, and even prior to that, I had worked in pharmacy for a little while. So I can't say it was always on my mind since I was a young kid that I'd be a dentist or an orthodontist. So I would say, of course, the first thing would be to make sure, kind of do your research, make sure this is what you want to do. You want to pursue something in healthcare, and just as important as knowing what you want to do, maybe is knowing what you don't want to do. So part of that involves, speaking to other health professionals, shadowing, visiting offices, and of course there's a lot of commitments, whether it's time commitment or financial. So I think my best advice would be, for sure, if you want to get into healthcare, one of the main barriers is going to be, your academics. So focusing on your grades and making sure academically you're strong and competitive, because it is, dentistry and orthodontics are both becoming more and more competitive from that standpoint. And whatever you can do to kind of help yourself stand out from the rest of the pack. So that'd probably be, and of course, like I said, shadowing, things like this, to make sure that that's the way you want to go, because it is a big commitment in terms of your time.
Thank you so much. That was really insightful. I've actually been thinking about going into orthodontics after I've gone through my whole treatment of braces. I think it's really impactful, how people can have their whole lives change with braces, and it's really insightful to think to go through shadowing. And I actually am considering being a pharmacist, so hearing that you also were a pharmacist is it just aligns with me, and it's really nice to hear that. So thank you so much.
Yeah, I think what's really important too is, and I think a lot of people when they think about the medical field or dentistry or anything else, a lot of the focus is, lifestyle. Maybe the thought that you're making a lot of money and stuff like that. But of course there's other rewards. Like you mentioned, the confidence that patients get. For me, my job is more rewarding when I see my patients and with the finished results. Their confidence, their smiles, laughing. That to me is kind of a bigger reward, and I think if that's your focus, as opposed to the potential financial rewards, then you'll have a much more fulfilling career.
Thank you so much.
I'm Kieran, and I'm the treasurer. Could you walk us through what a typical day looks like for you in your practice? And what are the key challenges you face as an orthodontist? And how do you manage patient expectations, particularly with long-term treatments like braces or clear aligners?
Okay. So my typical day, I mean, I guess I'd break it up into like, clinical, non-clinical, and academic, because I do teach at UNLV once a week. So when I'm at UNLV, my typical day is kind of working with the students. We have some seminars, working in the clinic, diagnosing cases, treatment planning, and working with the students and their patients. When I'm in my own office, from a non-clinical standpoint, there's kind of the all the background work that I guess people often don't think about is doing we do a lot of clear aligner treatments here, a lot of Invisalign, so a lot of it's kind of spent planning those cases out when the patient's not here, going through what we call the clin checks and the digital setups, paperwork, reviewing X-rays. There's a lot of work that goes in the background when patients are not here. When it comes to the clinical, in a typical day, we'll have some consultations, which are the new patients. Those are the ones that we'll take photos, we'll take X-rays, we'll go over our recommendations, kind of see what their chief concerns are and what their goals are with the treatment, and then that way we can plan out their treatment from there. And then, of course, we have our recurring follow-up patients that are either in braces or Invisalign and coming for their routine adjustments. From an expectation standpoint, I think the biggest, the most important thing is to kind of manage those expectations from the very beginning. So when I sit with the patients for my consultations and we're reviewing photos and X-rays, we'll go over all the details as far as what goals are achievable and relatively predictable, and which goals might be a little more unpredictable and we might not be able to fully achieve. So, that's one thing you'll hear a lot in orthodontics is you start with the end in mind. So you kind of have a end goal of what you want the patient's teeth and bite and everything to finish as, but you also kind of have to keep some of the realities and the treatment challenges in mind that you might not achieve all those goals. And it's a lot similar with the digital planning when it comes to Invisalign and stuff like that. It's a lot of it's kind of based off of computer models, which is not going to 100% translate into a human. So I think from like a clinical standpoint, the biggest challenge is that, with braces or Invisalign, we're talking about sometimes treatments that are going to be on average probably about 2 years, a year and a half or 2 years, and kind of having that not knowing exactly what the future holds, especially for younger patients who are still growing and their jaws are changing. Nobody knows what's going to happen in the future. So that's one clinical challenge is are you going to be able to finish how you want to finish? I'd say from a non-clinical standpoint, and something that is difficult for newer dentists and newer orthodontics is from a practice management standpoint. The clinical training is, everyone goes through pretty good clinical training, so that's usually not an issue. But from a non-clinical practice management, that's one thing that I kind of had to learn as I went along when I started my practice is managing staff, marketing, budgeting, all the stuff that comes with running a business, which is often overlooked, with the clinical being the main focus. So I would say those two are the main challenges.
Yeah, for sure. I like the way you describe the way you handle the patient's expectations, because I feel like for a lot of people, they can go in and have like an unrealistic vision of what their smile is going to look like after treatment. So I think it's really important to ensure the expectations of the results are clear beforehand, like you said.
Exactly.
Yeah. So thank you for the time to answer my questions. I really appreciate it. And I think it'll help some of our other members in the club understand orthodontics better.
Of course. Thank you.
Hi, I'm Jamie. I'm your vice president. Orthodontics has seen many advancements over the years, particularly with the rise of new technology like clear aligners and 3D imaging. How do you incorporate these innovations into your practice, and what role do you think technology will play in the future of orthodontics?
Okay. All right. Well, this is a very important kind of special topic for me. When I was a resident at UNLV, the topic of my thesis was clear aligners, and particularly when it comes to scanning technology, 3D printing technology. At that time, it was very new. It's still very new and constantly changing and evolving. But that's something that I'm very proud of with my office. When I built the new practice, a lot of the focus was I wanted to be very up to date with the technological advances. So that involves 3D imaging versus 2D. My thinking is a patient is three-dimensional, and we need to plan where the teeth are going to be in relation to the jaw in 3 dimensions. So I do think that that's the future of orthodontics, moving beyond the 2-dimensional imaging. Intraoral scanning, of course. I don't know if any of you have ever had actual impressions before, but as opposed to getting the goopy impressions now with 3D scanning technology of your teeth, the nice thing is we can kind of keep that record pretty much forever in a digital file, and not have to go through impressions. And of course, 3D printing. I do 3D printing in my office. We make clear aligners in office for some of the more minor, simpler cases. So I think it's very important for any practitioner to kind of be up on technology and how the landscape of their profession is changing. And I'm happy that we're kind of at the forefront of that as well.
Yeah, I think that the technology now is amazing compared to when I got braces. I had braces for 5 years, and they were telling me that I had to get my wisdom teeth removed and stuff like that. And it turns out when we went to this new doctor that it wasn't needed, and that there's technology now to avoid that type of stuff. And now my sister doesn't need to get that stuff. So I think it's really interesting on how orthodontics has expanded and how there's a lot better technology than there was before.
Yeah, mm-hmm. Yeah, definitely changing.
Hello, my name is Aaliyah Preciado. I am the social media director for Medical Society. Orthodontic treatment often requires patients to follow through with specific instructions and care plans over extended periods. How do you ensure patient compliance, particularly among younger patients, and what strategies have you found to be the most effective?
So this is a great question too. I probably should have mentioned this with the clinical challenges, but yeah, the patient compliance is obviously a huge factor with orthodontic treatment. What I'll typically tell patients is I can only control what when they're with me, at least, we do our braces adjustments roughly every 1 to 2 months. Sometimes our Invisalign patients we'll see every 2 to 3 months. And we can of course motivate them and control them on that, or help control their treatment on that one day that they're there. But for the rest of that month or two that we're not seeing them, of course, we're relying on them to be part of the team and do their part. So what I'll typically tell patients is if they can follow the instructions well, we'll either finish on time or earlier than our expected treatment time, and that'll give us the best results. There's a few factors. Of course, there's brushing, how well patients are keeping their teeth and the braces clean, whether it's using rubber bands to help with the bite. Age differences too. You mentioned younger patients, but it is kind of a spectrum. We have patients as young as maybe 7 years old as like their 70s, and everybody's different as far as their motivation. That'll probably be the biggest factor, is how motivated is the patient, how much do they want to contribute to achieving their best smile. Of course, parental involvement is super important too. We try to keep the parents involved to help motivate their kids and get through the treatment as quickly as possible with the best results. And so I would say probably the two biggest factors. One is treatment time. We don't want to prolong the treatment or delay the treatment. If patients aren't brushing well or their teeth or their gums are not healthy, then a lot of times we'll have to either remove the wires, or remove the braces altogether. So of course they wind up either not finishing their treatment or major delays in treatment. And sometimes there'll be additional costs too if they're constantly breaking brackets or treatment goes way over time. Then of course there's that I guess financial motivation to not prolong the treatment. But yeah, it is one of the challenges, and we do our best to keep our patients motivated to finish and have the best result possible.
Yeah, I recently had braces, and I know how important it is for patients to keep up with taking care of their teeth, like putting on the rubber bands and brushing and taking care of your teeth well. So it's good to see that you have to make sure that the patients are keeping up with that self-care.
Yes.
All right, so for our last question for you today, Dr. Momtaz, I had the privilege of being one of your patients, and I'm incredibly pleased with the outcome of my treatment. I've even had other dentists compliment your work, which is rare in the field of orthodontics. From your perspective, what do you believe sets your practice apart in terms of patient care and results? And how do you ensure such a high level of quality that stands out even among your peers?
Well, thank you for the compliment, and you did a great job too. So like I said, there's I commend you as well, because it is a team effort between the orthodontist assistants and patients, and that's my focus. I think from a clinical standpoint, what sets us apart is, as we mentioned before, the different technologies that we have, the newer technologies to help achieve better results. I did spend a lot of time getting board certified, and I still follow those standards. So we do have those board standards for how our cases should be finishing, and I think the important thing is not taking any shortcuts. So I do have high expectations when it comes to not only myself, probably my biggest critic, but also my assistants and my staff. Everyone has to work together, including the patients, parents, like everybody, to make sure that we get the best results. At my office, we're kind of constantly going through training with the staff, continuing education for all of us, including myself. And I think the most important thing is that open communication. And that's one thing I'm proud of with my practice as well. We really emphasize communication, not just with the patients, their parents, within my staff, but also with our referring doctors and the general dentist that we're working with. So I send them a lot of reports, both at the very beginning, kind of outlining what the treatment plan is, what the orthodontic diagnosis was, but also kind of keeping some open communication as far as the progress. There are a lot of cases that are multidisciplinary, so it's not just about orthodontics or general dentistry. Some patients will also need other specialists involved, whether it's gum specialists, oral surgeons, and it's important for the entire team to be on the same page for that patient. So that would so I think the important thing with peers especially is that communication and making sure that we're all headed to the same goal, and of course same with patients and parents too.
Yeah, I think that what you said really resonates with me. I've heard once at a quote at your office that really did stick with me. And she told me that having a good smile does take work. You have to work for it. And it really did stick with me, along with what you said, because it's true. If you're not keeping up your part, your ortho can't do all the work for you. You have to do your part, and sometimes your parents have to help you do your part. But also with that open communication that you mentioned, I think that's also really good, because if you for some reason do fall off of your regimen or your treatment, or you miss an appointment or something, I've always felt that open communication to be able to tell you about it, tell my dentist about it, and I think that's really cool.
Mhm.
Just so that we're all honest, that's what's going on, and that's what
Yeah.
makes it better to get back on track for treatment.
Mhm. Yep, exactly.
Thank you. So
Mhm.
that concludes our fireside chat. Thank you so much, Dr. Momtaz, for joining on with us. I think we've had some great insights, some great advice, and I really appreciate it.
Thank you very much.
Yeah, of course. Okay. That's the wrap. Thank you.
All
Bye,
right.
guys.
Thank you. Bye-bye. Thanks.